The idea for LITT in the brain started with a cafeteria conversation with a neurosurgeon colleague of mine. He had just done the first case of a stereotactic biopsy in our hospital, and we were talking about how that went, and then the conversation led to, well, wouldn't it be nice if instead of the biopsy probe that went down, if you could put something else magical down that hole and affect some sort of change in the tumor. And so I built a few prototypes, got some grant funding to do that. That took about 10 years before the technology caught up with the idea. And it wasn't really until about 1999, when Rich started with the company as well, that the technology evolved to the point where we thought, okay, now we can actually do this.
It was a small group back then. It was maybe 3 of us starting this off in the lab, working downstairs in the bowels of the hospital in a MRI lab next to the MRI room, playing with lasers and probes and MRIs, and attempting to prove that we can heat and treat some kind of tissue mimicking phantom and monitor that with the MRI.
So the original role that we thought LITT might play in the brain was for primary brain tumors, and we had really focused on that initially. We didn't really think about metastases at that point or anything else in the brain. We had really just focused on these patients with really bad outcomes, not really having any other options. And now the field of LITT has really expanded over time.
So where does this technology go? With the advances we've made in the technology, from the early ideas that Rich and Mark had, to the growing amount of robust clinical data, to growing acceptance by insurance companies. We have a great technology, we have a great platform for those patients who have a GBM, either upfront or recurrent, who have metastatic disease, who are looking for seizure freedom from epilepsy, and there are literally tens of thousands, if not hundreds of thousands of patients around the world who would benefit from our technology, and that is the long-term opportunity that we think we have ahead of us.